Well, hello everyone. How are you? It is me, Amy, and I'm getting to come to you live, which is always so fun. And I am bringing on a special guest, and we are going to talk all things premature ovarian insufficiency. And so, if that pertains to you or you have questions for that, I'm going to ask you to put questions in the question box down in the lower right corner, that circle that has the question mark. And I am going to bring on Sarah from Fab Fertile. And let me just see. Do I add as a moderator? I don't know if that's right. I think I have to, you have to ask to join, actually, Sarah. So hit the little movie camera with the plus sign in it, and then that should bring you into my waiting room. And go live with it. Let's see. I think this worked. Yeah. Okay. Here we go. Now I'm going to accept you in. Hi. There we go.
Hi.
How are you?
How are you?
I'm
Good.
good. How are you?
Good. We
Yeah,
made it.
we made it. I know. I am still in my workout clothes from this morning. It's
Oh,
like been a back-to-back day,
I
but
know. I just had a quick
and
walk.
you're gonna hear my dog in the background because I'm downstairs and he's gonna whine a little bit, but that's
Oh,
okay.
there you go.
It's good to see you. How
Good to
are
see
you?
Good. We're just out for a walk, and I was like, "Why is it so hazy out here?" And I guess with all these forest fires or something like that.
I
Like I'm in the
know.
middle of the country, like outside of Toronto, and I'm like, "What? Like you can smell the smoke in the air. Like what's going on?"
There was a fire near us in Nova Scotia, so up in Canada.
Yeah.
And we're all the way down in Connecticut, and it was impacting our air quality,
Yep.
and like it was crazy.
Mm-hmm.
And I remember living in California at one point during wildfires, and it was like you would drive and the ashes were on your windshield. I mean, it was just crazy pants.
Yeah.
So how are you? So I told everybody that we're going to talk about all things premature
Yeah.
ovarian insufficiency.
Yeah. That's good.
Let's get into it. So I was also just on your podcast, right?
Yes.
So that was released. What was that, last week? Was that
last Monday, 29th, I think. Yeah.
And that was all things about miscarriage, right? And getting the right testing and stuff. So if you guys want to check out Sarah's podcast, it's called Fab Fertile, right?
No, it's called Get Pregnant Naturally. So it's on
Pregnant Naturally.
Yeah.
Okay.
Yeah.
But you can follow Sarah at Fab Fertile, and then her podcast. And I was just on it, and you have like tons of awesome guests and awesome information. Yeah. And so for all my community, why don't you tell everybody a little bit about yourself?
Sure.
And then we'll,
Yeah. So I'm the founder of Fab Fertile, and I had my own journey with fertility where I was diagnosed with primary ovarian insufficiency or premature ovarian failure, as it was called, back when I was 28. So 25 years later, when you get that diagnosis, it's the same response. Sorry, you've got to go to donor eggs. There's nothing we can do. Yeah. What I know in the functional medicine and functional nutrition space, there's a lot of things we can do.
Yes.
And so I assembled a team that includes an OBGYN with a functional medicine background. She was for years in conventional medicine, just doing surgeries all day long. And then, had her own health crisis. And then, like so many of the functional docs do, have their own health crisis. And like, wait a minute, what is all this stuff?
Like that? Wake up and they're like, wow, I got to
they caught in that disease model, right?
Yeah.
And managing disease, and then move to the functional model. And so she's our medical case reviewer. We have functional nutrition practitioners that review our lab testing, really develop a targeted protocol. And then we have mindset coaches. So really believe in a mind, body, spirit approach, especially with POI. People have been told, sorry, donor eggs are your only option. Yeah. And so I went on to have both my kids with donor eggs, and my daughter's 21, my son's 18. And then, now helping couples that have been given this diagnosis, helping them getting pregnant naturally or with their own eggs. Like there's lots of things we can do. Yeah. When we look at your health, it's not like, we're not similar to you, like not like anti-IVF, but it's like pro health. Like, let's look at your health. You'll either get pregnant naturally. If you go to IVF, you're going to improve your chances of it actually working.
100%. Right. And like, there's a million ways to bring, well, not maybe a million, but there's a lot of ways to bring baby through, and none of them are wrong, right? They're all exactly what they're supposed to be for each individual. But I see our work as like getting you in the best alignment on all the levels, mentally, emotionally, physically, nutritionally, so that you can also be the mother we want you to be and we need you to be in this world. But then also, yeah, like if you wind up needing to go to IVF or even donor, you still, the vessel still needs to be prepared, right? And you still need to have the, if you will, the goods to develop a child into full capacity. But so, yeah, so you'll come at them from like this whole functional nutrition perspective, mindset perspective, and then create like a targeted plan. And so one thing I was thinking about that we could talk about is like, do you guys check for the ovarian antibodies, or do you want to get into that at all? Of like, what do you think about that? I suppose.
Yeah,
Is
like
like another thing.
we don't necessarily start there. Like we're looking at all the different stressors in the body, from like the gut infections, the food sensitivities, environmental toxins. Like so many people now are doing the PRP and things like that, and some of these things can be good, but to me it's like a band-aid. If you've just done that, you haven't looked at all the different issues going on in your body. Like some of the themes we see with POI are food sensitivities. We see gluten off the chart, like non-celiac gluten sensitivity. That was the same for me, where I didn't have celiac, so it's like a false negative for celiac. But people having like just off the chart. So we see the food sensitivities as a theme. A lot of leaky gut. So many people that were on, like I had the irregular periods, was put on birth control for many years, and then came off. I was on it for about 7 years, and then came off, and then that predisposes you to the gut infections and food sensitivity. So we see people with being on birth control for many years, for like myself, antibiotics. I had chronic sinusitis, chronic UTIs, took tons of antibiotics, which then destroys the health of your gut. So a lot of this is like leaky gut, and so then you end up being intolerant to your favorite foods. So that's kind of what we see too, right? In the food sensitivity piece.
So a lot of it, like, almost like our approach is similar, in like elimination diet, like kind of figure out the right fertility diet, if you will, the right foods for your body. And you're doing the same kind of thing of like looking at symptoms of like, okay, what else is going on? How's your digestion? How's your sleep? How's your skin? Right. And, seeing if there's any inflammatory reactions. Because typically in these POIs, I mean, even like your case in particular, like these really young girls that are getting this diagnosis, there is some kind of inflammatory response that's going on. That's like basically the body's then saying, I don't feel safe. I don't feel secure. I gotta shut down this system so I can just survive in the world. And so fertility becomes like, goes into the back seat, right? And communication with the ovaries basically shuts down. And so you're working at like restoring that.
Yeah, we see it all the time, right? And so someone, we've got some young people in too, and we help people from obviously 20s and 30s and things like that, and early 40s with like typically POI is loss of function of the ovaries before the age of 40. So and sometimes I just don't know if the diagnosis is correct for many people, right? And sometimes you've got people that could have Turner syndrome or Fragile X, or some of the the genetic piece. 33 with POI, diagnosed at 31. So we just had what was the one we were looking at today? She was 32. We were reviewing all of her tests, and she had a whole bunch of issues going on with her gut, from some parasites.
And are you doing like a stool analysis?
So we're doing the stool test, looking at the DNA of the stool. We use the GI map, and so found that for her. We found that for her. She was showing signs of leaky gut, where it was like she moved kind of to a good like elimination diet standpoint. She hadn't taken gluten out at that point before she came to see us, but she was doing more meats and things like that. And then she started being intolerant, and you can see on her food sensitivity test, she's intolerant to beef, and she's intolerant to fish and some of the other foods.
Which is like so unlikely. So then she's just triggered and reacting to everything.
So this inflammation, right? Another like ones too, where
histamine response of some sort.
Another ones where she had again, the gut infections are a theme, where we see people with either so the testing for leaky gut, so you can see that usually on a food sensitivity panel too, and then also on the food sensitivity on the stool testing, you can see
zonulin.
The zonulin marker, right? And then so for this other woman, she had a number of parasites and stuff too that we saw in there. But so we see the.
Go ahead.
So we see the food sensitivities, we see the gut infections, and the gut infections we see fungal issues, we see parasites, we see bacteria, and we see the H. pylori piece being where lowers your stomach acid, you're not able
Well,
to
and then
absorb all
like
your
I
nutrients,
always
right?
think too, right? Like I'm originally trained, like obviously I have a biology and chemistry background, but then I became like an acupuncturist, Chinese medicine person. And so
Mm-hmm.
we always see very like broad based that like if the digestion fire, we would almost say it, like is compromised, what that means. So say there's H. pylori, say there's parasites, say there's bacteria, say there's yeast, whatever we get to label it once we do the GI map or we get further testing. But like really higher level, what that means is the stuff you're consuming, even if you're eating a really good clean diet, you know, and you're taking good quality supplements, you're not absorbing them. So they're not doing for you what they could be doing for you because your gut health, your capacity to digest and absorb your nutrition is compromised. And until you repair that, you're not going to repair the hormones, right? And you're not going to reset the stage because the body is still saying, I can't get what I need. Like what you're giving me isn't working. And so I can't function. I can't pick up the pieces and start functioning with my ovaries again. Like it just can't do that. And then right too, I mean, I will use a Dutch test as well. And you can really see, I think you can sometimes identify low-lying infections and what they're doing to like the cortisol or cortisone, and you put that piece together too, that then there's this chronic stress on the body. So you might not be like chronically stressed or in chronic fight or flight, but your body is, where it's like, I can't do this. And so it really is about, right, healing that gut to improve absorption, but then also, you know, that helps regulate the nervous system and help the body. Like it really is like, I did a piece a while ago that about like the basis of really what I see is restoring fertility is restoring a sense of safety in the body. And I got some negative feedback on that. Like people didn't like that commentary. They thought like, oh, so I'm not safe. And it's like, no, what I mean by that though is the body's basically saying like, I don't have everything I need to do my job. And so if you want me to do this job, and then that's also the same thing of like, oh, but you're going to go and do PRP. I even like I know I'm going on a tangent, but like even the platelets, I still want to juice them up before you go and do PRP, right?
Yeah.
I want to make sure your
Yes.
growth factors are where they're supposed to be so that you can get the most benefit from that PRP. We're not just going to Band-Aid approach it. Even stem cell, I've had a couple girls do the stem
Yes.
cell treatment. And
Yeah.
same thing. I have a POI girl who just did it in Spain, 28.
Mm-hmm.
But same thing. I said, I want 3 months with you. We're going to work on this protocol. We did all the things, the GI map, the Dutch test, the genetics, all the mental health components. And so we have her on a solid protocol. I run herbs. And then now she just went and did it. So I feel like she's going to get the most bang for her buck in a sense, right?
Yeah, we have a similar approach where, yeah, you've got to work on, you can't out supplement like a poor diet. You can't outrun the stress.
Yeah.
Even if you say I'm not stressed. And we have many people, like I coach
Yeah.
a type A busy professional, like, yeah, and sometimes they'll say to me, I don't even feel stressed. And I would have said that back then. I'm not stressed. I'm like, let's go. I can do anything. But the
The
body,
body feels.
I had food sensitivities. I had these gut
Yeah.
infections. I was in group, my dad's a chemist and I grew up in working in his chemical factory,
A lot of
surrounded by all
exposures.
these chemicals, right?
Right.
And so we see, yeah, those environmental toxins piece and the mental emotional side of it, right? So similar to you, we have, the spiritual and the mental emotional side of that to really help with people, because with this diagnosis, you're told, like, if you're told donor eggs, that's a devastating thing, right? And people feel like, what, going to spend tens of thousands of dollars to, and maybe not, might not even work. Or sometimes we think that that's the only option.
Well, that's the thing too, of like, I see girls where they're being pushed down I mean, I know you see it too. They're being pushed down donor egg route and they're clear cut autoimmune. They're probably going to reject that embryo. Yeah. They're probably going to miscarry that donor. Mm-hmm. And so it's not about that. Like we have to make the body more almost like, I would say like implantable. Like it has to be more hospitable to a pregnancy before we even go and pursue that option.
Exactly. And we use the same thing too, where your body wants to survive, not procreate. And if it's under attack by all these different things, it doesn't feel safe. And your reproductive system is not online. It's down the hierarchy of what it needs to, you're trying to survive. It's in fight or flight kind of thing. Yeah. So,
I mean, I'm playing devil's advocate with you, but like, what's your typical response when people say, but then there's women in war zones who are really in fight or flight and they're getting pregnant. And so why not me? Right? Like, why is my body choosing to be in survival mode and not hers?
Yeah. that whole comparison thing, right? For us, well, comparison's a thief of joy, and we're going to go like, what about the drug addict down the street and the person in the war zone? We don't know what that's done to their health, but for you, like for someone that's dealing with the fertility journey, it's impacted our fertility. Someone else could have diabetes, heart disease, cancer, whole host of other health issues. For us, it's fertility, and we just need to then start dealing with it. And we can do the IVF side of things, but if we haven't looked at our health, I do believe that your health will come back. Like for me, I didn't look at my health, and my health then suffered in my my mid 30s, and I still would have said I had excellent health, but I was taking multiple, like I had UTIs, sinusitis, I had dandruff and vertigo, and I caught every cold and flu. And we see this a lot, like with some of our clients. It's not just like, oh wow. It's not, oh wow, but it's not like, oh, I just have POI. There's other things going on in the body, and those other things are huge clues, healing opportunities for us to address. And if you go, ask your REI, does diet or lifestyle matter? They're going to say, oh, maybe it's, it's okay, but it's not essential. But you're asking the wrong person.
Yes. Well, that's it. I think that's so important. I had this conversation like multiple times in the clinic yesterday.
Yes.
Of like, put your reproductive endocrinologist in this category. He's good at, or she's good at going in and getting those eggs out of your ovaries. We hope that they're good at fertilizing that egg and sperm in their laboratory. They're good at transfers. Don't ask them about nutrition. Don't ask them about supplements. They're not the people. They have limited time to look at that research. And the good, smart ones are actually outsourcing that anyway. They're telling you who to go to and who they trust. And so, like, yeah, I agree. Of like, know your resource in a sense, right? So this question right here, what about not having Fragile X, but having hypothyroidism? My POI is idiopathic. I mean, lovingly, I say this to you, and I mean it lovingly. There's no way it's idiopathic. Like, it's idiopathic to the Western doctors, not to us. There is a root cause of it, and it's typically an inflammatory and/or autoimmune situation going on, or like an underlying gut infection. So that's like, right. I mean, I think you would agree to, any additional.
We see like literally thyroid is like one of the
most common
things
things
from either it's been a miss, Hashis or Graves, it's hypothyroidism, and they're just taking, a medication for it and not going, what's the trigger, the thyroid.
And then how they check your thyroid antibodies, because you could be hypo and no one's checked your thyroid antibodies. You could have Hashimoto's. That could be like, I'm sure as you, POI and Hashimoto's are like literally 90% the same, like they're present. And then you add in celiac or non-celiac gluten sensitivity, right? That's the right term for it. And years ago when I was writing Yes, You Can Get Pregnant, I feel like I've told this story 100 times, so forgive me, but I interviewed a couple doctors, and I interviewed this guy, Hugh Taylor. He's the head of reproductive medicine up at Yale, and he was like a friend of a friend, and he was glad to get on a phone call with me, and he was cool. He was doing all this research on like plastics and how they're impacting fertility and toxins in the environment, so I like knew he was the right guy. And this is really before I feel like before we were really all talking about this, because it was like 2014, 2013. And I said to him, I go, if you look at the research, it's like there's PCOS and there's endometriosis, and then there's all this unexplained infertility, and then maybe POI or POA, it was called at the time. I said, but do you think like in all these cases, there's an underlying autoimmune or an undiagnosed autoimmune or inflammatory condition? And he was like, young lady, he said to me, he's like, you're onto something. He's like, we're actually now, and this is 2014, we're testing every patient when they come through for Hashimoto's and for celiac, because he's like, the high correlation with unexplained infertility. And then, I mean, you could have the diagnosis of POI or PCOS or anything, but they're looking, and across the board, we're seeing just a multitude of women that are dealing with fertility challenges actually also have Hashimoto's and or celiac or some other, right? I mean, how many ANA positives do you see, in your labs? I mean, all the time, right?
Yeah, we see the autoimmune component all the time, from the celiac to Hashis to Graves to lupus to MS to rheumatoid arthritis. RA, exactly. So we see that all the time, and then they're being pushed to IVF, and no one's in, functional medicine, functional nutrition is like the best thing to actually help to reverse this stuff. And people are, ulcerative colitis, Crohn's, being on medication for years. So it's really, it's not just, oh, I have this autoimmune thing. It's part of the puzzle. And then we start to address that. Then when you go in to do an IVF, if that's the side you want to do, it actually implants. So doing
We
that,
actually hold and stay, right? Because often, right, we're seeing the same thing, even recurrent pregnancy loss, which we talked about
right.
on the podcast, of like, oh, it's an egg quality issue. You need to get PGT tested normal embryos, or you need to go to donor. I mean, it's usually the same answer. And it's like, oh, absolutely not. It's actually not at all. Like, your egg quality is actually probably perfectly fine. There's an inflammatory reaction or an autoimmune reaction going on in your body that's either compromising quality when that embryo is developing, and or compromising the uterine environment, not allowing for implantation to stick. And then we have reproductive immunologists that are now looking at that, but still half of the REs out there think reproductive immunology is hocus pocus, which is fascinating to me. I'm like, have you not read the data? Like, I mean, what? Are you not?
Yeah, I just
not
believe in getting it.
I'm on PubMed every day. Why are you not on PubMed every day? You know?
Yeah. I just believe in getting a team, right? So it's not about like excluding your REI or RE or OBGYN. It's like, but looking at a functional
perspective.
nutrition practitioner, functional doc, things like that is key to, and then you're in the center, you know your body best. And a lot of times it's like the medical gaslighting, you've been dismissed, oh, there, you've got cold hands and feet and your hair's falling out, your skin's as dry as a lizard, but oh no, you don't have any problem. Your thyroid's fine. It's normal.
Yeah.
But is it optimal? And so really being able, right, to look at that, and that whole thing of being like well fed but malnourished, eating all this organic foods, but really are you absorbing? You've got H. pylori and you're not absorbing it. You're not absorbing all those.
I can't believe we just started doing the GI map really this past year. And I'm kind of like a fly on the wall, like similar to you. I have a functional medicine practitioner on my team, and because it's my practice, I have to sit on those calls, and I'm a nerd. I love to listen and learn, and I can't believe. I think every patient comes back with H. pylori or yeast.
Crazy.
It's crazy, and I'm like, oh my god, like this is it. This is it. I mean, it's part of it, but it's really cool to have things to solve for. And then you really do see dramatic shifts. I mean, it's interesting. Like, if I just keep my Chinese medicine hat on, we typically go that route anyway. Like, if I'm seeing a lot of GI disturbances, but not every H. pylori patient presents with GI disturbances.
I didn't.
Not every celiac patient presents with GI disturbances.
Nope.
Right? It's crazy.
Here. Yeah, I didn't have any of the acid reflux or GERD or any of those other symptoms, burping, but all that. No. And many people, if you do, then it's more advanced, perhaps, or it's more, there's a higher virulence factor. So we see that too, or sometimes. But so definitely is a theme we see. The whole, like, we're looking at the biochemical. I do believe it's equally as important to look at the mental emotional side of things.
100%.
Because otherwise you'll self-sabotage, because you'll be like, the doctor told me donor eggs. I don't think it's really going to work. And then does it make sense to me to, not eat bread anymore, or, not eat gluten, or maybe why do I got to take my toxins out? So it is really important to the mental emotional side of it. And if you're in like this can impact your, the relationship with your partner, pull you apart or bring you closer together. Most people that have gone through this, they already selected the solution that they thought was going to work, which was IVF, and it didn't work. They've invested a lot of money, and they're devastated. And now you were like, okay, we're going to do these changes, but it is kind of ripping the Band-Aid off, and really, and because I always say it's not a sick population, but it's not an optimal health. I was not in optimal health when I was going to the doctor saying, I got to go back to work. Give me some antibiotics. Like, I got chronic UTIs, sinusitis. I got colds and flus. That's not optimal health. Like, you shouldn't be dealing with those things. And we see a lot of people with their immune system so compromised. And then all the stress, we just keep pushing ourselves and going further. And let's go, that type A behavior, which will have served you. But then is your body now saying, whoa, hold on. Hold on.
Or I'm at capacity, right? The mental emotional piece, I agree, is like, I think it's the cornerstone too, in the sense of it really helps you put all the pieces together in this loving, kind, supportive way, compassion for yourself, versus like the very masculine approach of like, now I have to do all these things, and I'm gonna check all these boxes, and I'm gonna do, an elimination diet or whatever it is, and I'm take all these meds, and I'm fixing, versus like, this is a path of discovery, and I'm learning how to best support myself, and then and my partner, if you're in a partnership. And and it really is too. I mean, I've been on like this Joe Dispenza binge lately. I don't know, as I go in and out, I'm obsessed with him, but the last few days I've just been like listening to him nonstop, and he was just saying like, your personality creates your reality. But also like, a lot of what I talk about in bodybuilding too, of like this emotional inflammation component, like it changes your physiology, like 100%. It's not hocus pocus. It's not made up. It's not theory. This is actually scientifically shown that your brain and your beliefs impact your physiology. So if you're not looking at that piece, it's like I think, you know, like similar to like you can't out supplement a shitty diet. You can't out supplement a shitty mindset. You know, you just can't. And so much of it is like a lot of the books out there and a lot of the information out there is just like, oh, you got to get on NMN, you know, that's going to change your egg quality. And I'm all for it. Like, listen, I love recommending a good NMN supplement these days, but, and antioxidants, like I'm all for it. However, if you're not absorbing it, it's a waste of money. And I think someone asked too of like, how do we improve absorption? I mean, I think like one thing that, you know, Sarah and I are both using in our practices is the GI map. We do like that. It's a stool analysis test. It's, I pay $362.40 for a test for each of my patients. And, that's at cost. And then someone has to review it for you. So it's not inexpensive, but it does really help you understand. I mean, other ways you can do it is like the book that I wrote, The Egg Quality Diet, is an elimination diet. That is another way to do it and to start jumpstarting healing the gut. However, if there are low-lying infections, that's not necessarily going to be the direct fix. You actually may need a course of antibiotics, or you may need a course of herbal antibiotics, or both, or right, there's a lot of things that could be going on that I think, you know, these additional functional medicine testing, like we always use the Dutch test, we use the GI map, and we do genetics, and then we kind of piece all that together. And then help you come up with a clear plan. And then also like your symptoms should be telling you whether or not you're properly digesting and absorbing.
Yeah, we're doing similar testing. We also do a vaginal microbiome too.
Yeah, I'm getting into that. I just did the Evie test myself. They sent me one and I did it. I'm waiting for my results. Once I get my results, I'm going to do a live with Evie. So, and I like the Fertilisys. I think there's a couple really good ones out there, right? And yeah, I'm typically saying go get a test for endometritis, but that's uterine. Right. And it's a little more invasive and aggressive, whereas the vaginal microbiome, and I feel like too, if you look at the research, that's where a lot of it's going, of seeing that when the microbiome in obviously the gut, but in the vaginal area is off, it's almost like a clear-cut correlation with fertility challenge.
UTIs, BV, miscarriage, someone on the fertility journey, thrush. They've got some really good research in the UK. People on our team do kind of. They're kind of cutting edge over there, and it's definitely the vaginal microbiome, and then also we do hair as well too, to look if there's mineral or heavy metals, and people get very excited about the testing, probably like you, but it's, you know, and I feel like a broken record, but it's also equally important to do the mental emotional.
And that's the hardest. It's like it's not like take this 3 times a day. Like the mental emotional work is work.
It's work.
And you got to like, again, listening to Joe Dispenza, you got to show up for yourself. And it's like, it's a lot easier to blame and to push away. And again, like not name calling by any means, but I mean, just meaning even to myself of like, it's a lot easier to just be like, I'm too busy to meditate. I'm too busy to journal. I'm too busy to do these things. Or this happened and that's why I'm mad. And it's like, okay, well, we got to unpack that. Yeah. And so it's a multifaceted approach. But typically, I think when we're thinking about ovarian function being compromised or being shut down, as it is in like POI, you really do need to like kind of backtrack and think, okay, why is the brain not communicating? That's a mental emotional piece. And now, why is also the body saying like, I have to shut down this part of my system because I just don't have the goods to. I can't prioritize procreation right now. I just can't. And what is the reason for that? And it's not idiopathic. There's a reason.
There's a reason, which is empowering, right? There's things you can do. So
and there's things you can do to fix it. 100%.
Because I'm kind of like, let's go and do something. Give me the plan. That we need to then. We use heart math as well too. Like used in 25 years of study and 400 peer-reviewed studies. And heart, Joe Dispenza's done all kinds of research and studies using heart math and your HRV, and you can
HRV is so good.
Meditating all day long, but maybe it's bopping all around long, and you're still full of anxiety and worry, and you're stuck up in that fight or flight, and the body still thinks it's not safe. So that can be super helpful too.
100%. Oh, it's so great to talk to you. So any parting words? I mean, I'm sure you have some good, your podcast probably covers this in detail too, POI, so we can direct everybody there to listen to your podcast and check out all the work that you're doing.
Yeah,
Yeah.
awesome. Yeah, I've got a ultimate guide too for getting pregnant this year with low AMH and high FSH too. So it's at gpthisyear.com. So getpregnantthisyear.com. So they can check that out. But yeah, lots of stuff on my podcast. I've been around for 5 years, and tons of functional docs and nutrition practitioners. And Aimee Raupp is one there on there as well. So definitely.
Yeah, I feel like I've been on more than once, haven't I? I feel like, yeah.
No, I think you're just, yeah, it was the first time.
It was the first time?
Yeah, I know.
Oh.
I know. But definitely check out her episode. We talk all about repeat miscarriage. So already getting really good feedback about that episode.
Yeah. And thanks, Sarah. We'll do this again.
Awesome. Thank you.
Okay. Thank you, guys.
Okay. Take care.
Bye. Have a good day.
Bye.